Thank you for the kind introduction. My name is Mireia Santacreu, and I'm going to talk about if long-acting drugs can help the non-adherent patient. This is my index. I'm going to talk about the clinical experience with intramuscular injections, the adherent factors could affect to these patients, long-acting adherence treatment, schedule uses, the relationship with the patient, the benefits and barriers, and my personal experience. Point 1, clinical experience with intramuscular injections. Well, I've been working for 5 years in clinical trials with phase 2B and 3B long-acting cabotegravir plus long-acting rilpivirine administered every 4 weeks and every 8 weeks. I've been participating in LADE2, Atlas, FLAIR, and Atlas 2M. We have at the unit 25 patients, 2 women and 23 men. 2, the adherence factors. Well, the therapeutic adherence factor could affect to these patients. We have especially 4. We have the therapy, the adverse events that we could have with the oral drugs, the complexity of the treatments, the long-term treatments. Of course, the patient. We have the psychological problems that they could have, the skipping appointments, the negative about the medication, the disease absence, the awareness of the illness, and socioeconomic, if they have or not the family support, the healthy system access difficulties. We have, of course, the health system, the relationship between the patient, and the follow-up of the visits. 3, long-acting adherence treatment. So we have 2 kinds of patients. We have a patient who normally follows up the visit, but he has some problems with antiretroviral treatment non-adherent. These patients used to forget the pills, and it's not very good taking the treatment every day. And on the other hand, we have a patient who has compliance and he used to lose to follow up the visits. They forget to do the blood test and everything. And also it's very bad with antiretroviral treatment non-adherence. So between those kind of patients, we could think which one is better for this kind of treatment. So in our opinion, normally it's going to be a better candidate, the one who attends the clinic but has problems with the pills. And of course, the other patients that have very good adherence and follow up the clinics. But the patient who forgets the pills and attends the clinic, it could be a very good candidate because this patient, it's a responsible patient because he comes every time to the clinic, to the visit, he has the blood test and everything, but has some problems with the pills for many other factors that we have to explore and to check. And maybe with this treatment, it's going to be better because maybe it's because they have problem with the schedule at home for the time work, for the family, because taking pills every day, it could be very stressful. But if you have to come once to every 8 weeks, maybe it's going to be suitable for the patient. So how do we get another patient? So it's the patient motivation is essential to have a success for this treatment. Of course, it has to be a patient decision, and we have to check the adherence factors. So those people who perceive seriousness and personal vulnerability to the disease, feel capable of being adherent, value more benefits than cost, will have a better attitude toward adherence. The decision to be an adherence is influenced by the support and opinion to the environment. So those people who are well informed about the adherence, feel motivated and have support for it, are more likely to have adherence skills and confidence in knowing how to take the medication well. So 4, the schedule uses. So for this treatment, of course, we have a flexible window. We have a window about 4 less 7 days and a maximum of 9 weeks to perform the visit. That it's very good for the patients. So the schedule usage that we used to have is what we were talking about the working hours, because these patients normally they have to perform the visit in the morning or in the afternoon, and they have to leave their work to come to the clinic. So this is can be a issue. And of course, the family conciliation, the possible trips or illness like COVID infections right now. And this thing, it could be a challenge to have an adherence of this treatment, of course. But we used to have some tips, and we used to use the electronic calendars. We have phone call reminders. We call patient every week or every day before the appointment. We have, of course, a mobile phone applications. And then in our hospital, we have a hospital message system that we send a message 2 days before. So with all these tips, we normally, well, in our unit, we have we have very good adherence with that patients. So how to improve the adherence based on communication perspective? So the patient reminder system that we talk about, the collaborative communication, it's essential to have a very good communication with the patient, and the patient education, it's the most effective things that we can do for the patients, and of course the counseling basic strategies. 5, the relationship with the patient. So to have satisfaction and motivation for the patient, what we can do for them is to individualize the patient care. It's very important because each patient is unique. Each patient needs a special care. So we need to individualize and to see any case, and then have a lot of flexibility, because this treatment, it's a very comfortable treatment, but sometimes you need to be flexible because this patient have work, have family, and have trips, have illness, and have many factors that can affect to the appointments. And of course, we have to have empathy as nurses that we are, and of course we have to have patient confidence. I think this is 4 things for me are the success for this treatment, and for this reason I think we have a motivated and satisfied patients for this kind of treatment. 6, benefits and barriers of this treatment. The benefits is that the stigma is being reduced. We have a lot of benefits for psychological and emotional benefits, because they feel very good with this treatment, because they forget that they have an infection. They forget that they have to take any pill, and I did not have to make explanations to anybody if they share they share apartment with another person. So they have more privacy and confidentiality, and it suits for their lifestyle, and of course increase the contact with the HIV unit, because if they have any problem, if they have any disease or anything that they want to tell, they want to share, they can do openly. And it reduces, of course, the drug and food interactions. And the barriers that we have on that treatment are the injection site reactions, the frequency of the visits, the waiting time of duration of the appointments, if they have problem, if they move the area, they change the area, or they have to travel for holidays or for work. And then about my personal experience is that most of our patients that are participating right now in clinical trials with the intramuscular injection are satisfied. They would like to continue after this trial because we have been asking about continuing, and most of them, they want to continue with this treatment. And well, some of the injection site reaction must follow up and check it. As I told before, individualization of the patient is the key of the success. And my conclusions are that long-acting therapies can help in some of non-adherent patients. No, it's not a treatment for everybody. It's a treatment especially for a non-adherent patient for oral treatment drugs that attends a follow-up visit. And this could be the best candidate. And of course, the motivation of the patient, it's going to be the key of the success for this therapy. We have to still working of the factors that influence to the non-adherence, and prevention and promotion the patient adherence therapy is essential to have a very good adherence on that treatment. So thank you so much for attending me. That's all.